Hi, today we're gonna presentate about the factors influencing the health of a newborn baby. As a student of Bachelor of Early Childhood Teaching, we have to know what are the factors. In this group, we have five team members, which is me, Jerica, Angela, Nisha, Rania, and Sabitri. So let's jump to the topic here. Yep, as we all know, the health of a newborn baby is a critical concern that significantly impacts their well-being and also the long-term development of the baby. Yep, so every newborn has the right to high-quality universal newborn health care. Infants have the right to proper breathing, warm, feeding, and protection from the harm and the infection, okay? And all infants should have the access of essential newborn care, which is the essential care that its baby requires in the first few days after the birth. As fetal neonatal care includes both critical care throughout the newborn phase and also the immediate treatments at the time of delivery. That's according to the World Health Organization. Yep. Next one will be the fetus growth and development within the womb can be influenced by many factors. We have eight factors that we're gonna discuss in this presentation, which is the first one will be the diet during pregnancy, such as nutrition, folic acid, and then the second one, the mother's age, younger mothers, older first-time mothers, and the third one, number of pregnancies. Number four, maternal health like blood pressures, edema or swelling, also the protein. And then the next one will be the smoking habit, which is gonna cause the baby having a low birth weight and born prematurely. And then the next one, the bad habit as well, which is the alcohol. It's gonna cause the fatal alcohol syndrome. The next one is the substance misuse, such as prescription, non-prescription, and illegal drugs. And the last one, it will be the infection, such as rubella, cytomegalovirus, like CMV. And the next one will be the toxoplasmosis syphilis. It's according to Majid C, Bruce T, and Manny Morton on 2016.
Nutrition factors, which include the nutrition food, play an important role in the both mother and baby's growth and development that required for the healthy pregnancy. There are different factors such as maternal diet and if a mother is taking any harmful substances like alcohol, smoking, and drinking. And like in the maternal diet, if the mother is not taking like proper nutrition which contain fat, minerals, vitamin, carbohydrate, such as food like whole grains, meat, milk, egg, etc., that's required for the healthy mother and healthy babies. And if the mother is taking the alcohol, smoking, and drugs, also they might cause for the preterm labor, delivery, and the low birth weight, and babies who is born with the different kinds of abnormalities. And for the healthy mothers and the babies, the mother need to take the different type of supplement like folic acid, iron, calcium, and need to go for the regular checkup with the doctor like 4 to 8 weeks. They need to go for like once a month for the checkup, and 28 to 36 weeks they need to go for like every 2 weeks for the checkup to find out the mothers and the baby condition, how they are, if they are having abnormalities or not. For the sugar test, blood test, every times they need to go and find out if the baby is good or not. For the last month, like 36 to 40 weeks, the mother need to go for the every weeks for the checkup. And the other one is genetic factor. Genetic factor is the condition that is generally inherited and eliminates that transfer from mother to the children. In the genetic factor also that transfer from parents to the children, there are different kinds of the factor include under the genetic factor, like such as disease condition, family history, parental age. If in the disease condition, like in the families they have any parents have the cystic fibrosis and sickle cell anemia. Like cystic fibrosis is the condition or disorder in which the lungs and the digestive system are blocked with the mucus. And the sickle cell anemia is the disorder that occurs in the blood in which the red blood cells are become sickle shape, and that cause the pain, tenderness, and infection in the bodies. Like in the family history, if anyone has a chromosomal abnormalities, then the baby might born with the Down syndrome. Down syndrome is a conditions in which the baby born with the abnormal chromosomal, like the babies born with the 21 chromosomes. Usually in the healthy babies we have the 23 pairs of chromosomes. uh, and the parental age also play a vital role for to have been the healthy and growth developed babies. If the parental age is more than 35, then the baby might born with a preterm low birth weight and different kind of disabilities.
So, first of all, environmental factors affecting the health of a newborn baby. There are many factors that affect the child's health, the most important and most famous of which are air pollution, toxin exposure, and pesticide exposure. For air pollution, breathing air pollutants during pregnancy and after birth is dangerous to the health of a newborn's respiratory system and development. So, this negatively affects the child, especially his respiratory system, as many children are exposed to asthma, including many who were put on oxygen for a certain period of time because of this for air pollution. Next, toxin exposure. Heavy metals like lead and mercury, which are present in the environment, can affect the neurological development of an infant. Third, pesticide exposure. Some pesticides can cross the placental barrier and therefore cause birth defects and developmental disorders in the fetus. So this is a risk to the fetus and the newborn. As for the newborn, it also poses a risk to the immune system, leading to problems in resisting infection and also affecting the digestive, nervous, and respiratory system. Next slide is about birth factors. There are vaginal birth and cesarean section. For vaginal birth, usually results in a faster recovery for the mother and exposure of the infant to maternal bacteria. So it is a natural way of childbirth that takes place without surgical intervention and is less dangerous. For cesarean section may be required because of medical issues. For this section is required surgical intervention under anesthesia. So this procedure is performed, for example, to deliver twins, to the baby in an abnormal position, and maybe premature birth. Next slide is about birth complications. Such factors as oxygen deprivation during birth have adverse effects on the general health and development of a child. Immediate postnatal care, this entails assessing the baby's temperature, physical change, and general health status. The APGAR score checks the physical state of the newborn. So after the baby birth, after 1 and 5 minutes after birth, through the assessment should check of the heart rate, respiratory rate, muscle tone, reflex, and the skin color. Last but not least, about skin-to-skin contact helps the baby to bond, control his or her body temperature, and enhance the circulation of blood in the heart and lungs. So for skin to skin, also what makes him feel safe in the smell of his mother's body and hearing her heartbeat. Finally, breastfeeding initiation after birth has benefits on the immune and the digestive system of the baby.
This is Savitri Banya, and I'm going to talk about breastfeeding, which is the factor of birth which influence newborn babies. Breastfeeding provides complete nutrition and immune support essential for baby's growth and development during the initial month of life. The benefits of breastfeeding are nutritional benefits, health benefits for infants, bonding with mothers. Nutritional benefits means and breast milk offers complete vitamins and minerals that meet a baby's necessities, which include protein, calcium, vitamins D, iron, and iodine. Health benefits for infants. Breastfeeding supports optimal growth and development, offering numerous health benefits, which include immune protection and reduced risks of chronic conditions. And the third one is bonding with mother. So breastfeeding also plays a significant role in building emotional security and trust between mothers and child. The physical closeness and skin-to-skin contact during breastfeeding promote love and comfort, enhancing the mother-child bond. This bonding experience can contribute to a baby's emotional and psychological well-being. Let's go to the next one, which is feeding options beyond breastfeeding, which are formula feeding and mixed feeding practices. Formula feeding is the process for mothers who are unable to breastfeed. Formula feeding is viable alternative modern infants. Formulas are designed and to closely mimic the nutritional composition of breast milk, providing necessary nutrients for babies' growth and development. Formula feeding can offer flexibility and convenience for mothers. And the next one is mixed feeding practices, which includes mixed feeding, which combines breastfeeding and formula feeding, which can provide optimal nutrition and support for both child and the mothers. And the last one is importance of vaccination and immunization. Vaccination are critical for protecting babies from infectious disease. They provide long-term health and benefits by helping the body build immunity against specific pathogens, reducing the incidence and severity of diseases. And importance of immunization is immunization helps sustain a healthy life by preventing the spread of infectious disease within communities. It is a key public health strategy that not only protects the individual but also contributes to herd immunity, thereby safeguard those who cannot be vaccinated due to medical reasons. In all, breastfeeding offers unparalleled nutritional and health benefits for infants, along with fostering a strong emotional bond between mother and child.
Hello, it's Vinisha, and today I'm gonna talk about the relationship between our parents and the child. The parent-child relationship is a fundamental bond that profoundly impacts our child development. It involves emotional support, effective communication, and then constant discipline, which together foster a sense of security and then self-esteem. Throughout parenting model behavior and value, guiding their children toward independence and then responsibility. This dynamic involving relationship is crucial for the child's social, emotional, and the conjugating growth, forming the basis of their future relationship and overall well-being. Whereas it has bonding and attachment, it has three topics. The significance of early bonding, emotional and then mental support, effective on the development of infant. Let's go to the next topic. Next topic is socioeconomic factor. Socioeconomic factor impacts a range of conditions related to the individual or the group, economic and social outstanding, including income, education, and employment, and the access to the resources. Whereas these factors significantly influence quality of life, opportunity, and the overall well-being. Higher social economic status often correlated with the better health outcome. Whereas it has outstanding social economic factor is essential for the addressing inequalities, promoting an equitable development, whereas it has three topics in the socio-economic factor. One is parental education, income level, access to the resource of healthcare, social support system, and the next is healthcare accessibility. Healthcare accessibility, it refers to the easy way that individual can obtain medical services. This include factor as availability of healthcare facilities, affordable of care, transport, and the preference of healthcare profession. Accessible health insurance that the people can receive timely and effectively medical attention lead to the better health outcome of the child. Whereas barrier to access such as high cost, long distance, insurance coverage, and then can lead in the delayed treatment, unmet health needed, and decrease them disparities. Ensuring equability access to the healthcare is crucial for the healthy society, whereas the access to the practical care has the regular checkup and the emergency care, whereas the health education has the parenting classes for the baby and the detail regarding infant health.
Yep, that's all for the presentation about this topic. We also use some references here, as you can see in the slide, this one as well, and here's the last one. And also, we also use the Gen AI ethically. We use Quillbot for this presentation. That's it from us. Thank you, Miss Dicky.